Welcome to the seventh topic of 8 in Unit 1, Section 3, Pathophysiology of Common Injuries and Dysfunction. Myositis ossificans is caused by an extrinsic injury sufficient enough to damage the periosteum of the bone, but not enough to break it. This will cause the osteoblasts, the bone builder cells, to be released, where they will migrate to the hematoma in the muscle. The osteoblasts will start the repair or calcification process, but in the muscle rather than the bone. If left to their own devices, they will build bone within the muscle fibres. The area needs to be immobilized. This will then stop the osteoblasts from building further bone and allow it to be reabsorbed, enabling the muscle to return to normal. The most common site for this is the quadriceps. The signs and symptoms are reduced range of movement, pain on contraction or stretch, and a palpable hard lump in the muscle. Possible causative factors are extrinsic trauma, often in a contact sport like rugby. Treatment is often self-administered with guidance, such as icing, immobilizing. Physiotherapy may be required, and in extreme cases, surgery may be an option. However, it should be checked out by a medical profession and guidance given by them. Shoulder impingement, commonly called swimmer's shoulder. This is when the soft tissue structures become trapped in the subacromial space between the acromion and the humerus. Several structures pass through this space, including supraspinatus, infraspinatus, subscapularis, the long head of biceps brachii, and several bursa. The signs and symptoms for shoulder impingement are pain under the acromion process. This is generally when working overhead, and specific isolated movements. History of overuse or sudden increase in workload. Elevated protracted shoulder girdle. Potential thoracic kyphosis. Muscle imbalance. Restricted shoulder movement. Compensatory muscle patterns. A positive test such as a painful arc test or empty can test. Often there is pain but reduced in passive movement due to the structure still being impinged but without the added pressure of the deltoid. The possible causative factors are joint laxity, overuse, extrinsic trauma, muscle imbalances, strains to surrounding muscle structure, acromion and humerus moving closer together. This could be a muscle imbalance or an injury, or the structures that pass through the space becoming inflamed, again due to injury or friction. You can treat here, but you might need to work as part of a team. It depends on the cause and how soon it has been caught. Icing of the inflamed area and massage of the associated muscles is the first place to start. Medical professionals may recommend non-steroidal anti-inflammatories or even steroid injections. Next, we have adhesive capsulitis, commonly and aptly known as frozen shoulder. This condition goes through a process of slowly freezing, so you gradually lose range of movement, a frozen stage where it stays as it is for a while, and then finally slowly thaws. The whole process can take up to 2 years, but has been known to take longer. This is caused by various things happening in the joint. The capsule of the glenohumeral joint starts to thicken, adhesions will form, the surrounding musculature starts to contract, and there is a loss of muscular strength from the lack of use. Finally, the shoulder becomes fixed or frozen. The signs and symptoms for frozen shoulder are a restricted range of movement, which could be slowly getting worse for no reason. There may be pain, especially at the end range of movement, and in the long term, muscle wastage. Possible causative factors is a previous injury, other medical conditions, and they're not really sure. Massage won't do it any harm, but it's also unlikely to help. It will benefit any compensatory issues. Physiotherapy is the first port of call, and non-steroidal anti-inflammatories can be used, along with steroid injections. I have had one client have surgery, but normally it's just down to time. This is a very frustrating condition for the client. Acromioclavicular separation is what it says it is. It's the separation of the acromion and the clavicula. Often the acromioclavicular ligament will be damaged. It is normally caused by an extrinsic force pushing the shoulder girdle down. The clavicle is stopped by the ribs, but the acromion keeps going, causing the separation. The signs and symptoms for this are pain and deformity of the acromioclavicular joint. In severe cases, pain on muscle activation of those attached to the clavicle and the scapula. There will be reduced range of movement and a palpable gap. This is caused by an extrinsic force. Not a lot for the sports massage therapist to do here at the start, but again there will be a lot of tight muscles and compensation issues once the injury is healed. This really needs to be looked at by a medical professional. Lateral epicondylitis is commonly known as tennis elbow, and then you have medial epicondylitis, commonly called golfer's elbow. They are on the opposite side of the elbow, and it is an irritation of the attachment sites for the muscles of both the hand and the forearm. They are both caused by repetitive movement, and it is a common problem, especially in people that use their hands a lot, such as massage therapists, sports using rackets or clubs, or where people do a huge amount of typing. Signs and symptoms for these conditions are pain on the appropriate epicondyle and a weak grip strength. Additionally, for the lateral epicondylitis, pain on resisted extension or stretching the extensors, and the extensors are tight. Additionally, for the medial epicondylitis, pain on resisted flexion or stretching of the flexors and tightness within the flexors. The possible causative factors will be weak flexors or extensors, depending which side, overuse, trauma or extrinsic damage, and doing too much too soon. Massage can be very effective in treating this, working predominantly through the forearm in both cases. I will work the flexors and the extensors. I also work above the elbow, but the focus is below. Ice on the pain can be helpful, but the key is finding the cause. I had a client once that used to build websites and spent a huge number of hours on the keyboard. I asked him to look at his keyboard and mouse setup. After doing some research, he invested in a new keyboard and mouse. Once we'd resolved the issue, it never came back. Thoracic outlet syndrome is generally caused by muscular or structural changes, such as fractures or tumours which compress the brachial plexus. The plexus, along with the brachial artery and vein, pass under the clavicle, and this is where the issue can occur. As there is a nerve involved, you can get radiating pain into the shoulder, down to the fingers, pain in the neck, shoulder, arm and hand, along with other neurological symptoms in these areas. Swelling locally and or distally, and possible postural deviations within the upper trunk. There may also be muscle weakness and atrophy. The possible causative factors are anything that changes the space the nerve travels through. This would include fractures to the clavicle or ribs, injuries to the shoulder, enlarged lymph nodes, tumours, hypertonic scalenes and or the pectoralis minor, possible postural deviations or a congenital condition. You can treat if this is a muscle issue, but any concerns that it is not associated to the muscle, you need to refer or defer to a medical practitioner. Next we have long thoracic nerve damage. There is actually a nerve called the long thoracic nerve. It is quite superficial and part of the brachial plexus. This nerve innervates the serratus anterior, so if damaged may cause weakness or paralysis to this muscle. It can be easily irritated, for example, by continually having a bag on the shoulder in the same place. Signs and symptoms are obviously weakness or paralysis of the serratus anterior, winging of the scapula, pain in the shoulder, reduced range of movement, and atrophy of the serratus anterior. Possible causative factors are extrinsic impact of the shoulder, repetitive shoulder movement, heavy or prolonged loads on the shoulders. Again, sports massage can be employed depending on the cause of the issue. If you are unsure, refer or defer to a medical practitioner. As you can see in this section, there are a couple of injuries you can treat in the right circumstances. With a thorough consultation, you will be able to decide if you or a different discipline is best suited to deal with the client. That's all the injuries for this section. You can now complete the quiz and move on to your next section.